it's time for South Africa's state of disaster to come to an end, and this is the suggestion coming from Western Cape Premier Winde. He says ending the curfew was a positive move. However, government needs to go a step further. The national state of disaster was extended to the 15th of this month. And the Premier joins us now live from Cape Town. Thank you so much for your time, Premier. Good morning to you. And I don't think we've had a conversation this year, so compliments to the new year to you as well. So let's get into it. Why do you think we should actually move a step further instead of just ending curfew, but also ending the national state of disaster?
Good morning. Thank you very much, and also Happy New Year to you. I think really what we've got to do is we've got to put a management system in place that creates the new normal. I mean, you know that the virus is not going to disappear altogether, but I think we've now moved in with the fourth wave, Omicron. I think we've moved into that state where the severity of the virus seems to be coming down. I'll never forget Professor Karim saying, you know, when the mutations happen, you'll start to see them weakening. Well, I sincerely, I'm pretty sure that that's where we are right now. The second thing is you put disaster management declarations in place. You put lockdowns in place to protect your health system, to save lives. You know, you don't want to run out of hospital beds. You don't want to run out of oxygen. You need to protect your frontline workers, those healthcare workers that are on the front line. You can't overburden them. Well, quite frankly, right now, we're managing this pandemic with beds to spare. We know how to do it, oxygen to spare. I mean, if I look at the ICU bed take-up now compared to hospitalizations, and I saw your presentation or your slide earlier on infections, but the real thing to watch is hospitalizations. How many people in hospital? How many people in ICU? Now, last week we had about 70 people in ICU. Now we've dropped to below 30. I've got 1,700 citizens in this province in hospital, but they're not needing that high care as we were before. So quite frankly, we need to now drop the disaster. Now, in order to drop it, what does the disaster give us? It gives us the capability to do things maybe quicker. It also gives us the enforcement capabilities like masks, etc. Yeah. I think we need to move to behavior change. Citizens must do that themselves. We don't need to do it from a government point of view.
Right. I mean, you're definitely echoing there sentiments from Professor Shabir Mahdi saying, I think we should move from COVID numbers to hospitalizations and deaths. That number quite important there, according to Professor Mahdi. But also, you of the view that it's time to actually normalize finding ways to live with this virus instead of, you know, trying to be under lockdown, have curfew, because that has a knock-on effect, again, on the jobs and livelihoods of so many people.
Absolutely. I mean, so first of all, I mean, we're looking at the death rate now. It is way, way lower than it has ever been. At the moment in this province, it's about, say, 1 to 2 a day, and we're sort of beyond the peak of the curve. This is now when it should start really be picking up. So that rate has dropped tremendously. That's because we've got high rates of vaccinations in people who are susceptible or at risk. So our 60 and above vaccination numbers are looking really good. And, of course, people with comorbidities. So, you know, as the severity of the virus drops, we're protecting citizens on the other side. We need to get behavior change right. That's perhaps wearing your mask now when you are sick, when you're feeling sick. You know, you don't spread the virus to other people. You make sure you protect yourself, and that the economy can go. We need the next pandemic is this pandemic of poverty. The pandemic of job losses. We've got to now focus. We need to be declaring a disaster on that side, not a health disaster anymore. We've got the capabilities. We've got the mechanisms. We understand it, and citizen behavior and government. We all play our part, but we now need to move on to that next stage.
All right, Premier, I can't let you go without asking you about the latest developments. I mean, coming from the fire at Parliament, speaking to City of Cape Town's rescue spokesperson, Jermaine Carolsa, earlier on, saying they have contained the blaze. I mean, what do you make of this fire? I suppose just getting your commentary here and what you suggest should be an alternative, obviously, so the work of Parliament and the National Assembly can continue.
Yes, thank you. I mean, absolutely devastating. You know, I watched it from the beginning when I was actually going out for a cycle, and on the day that it started, and I rode past there and had a look. It actually looked like I would spend quite a bit of time there. It looked like it was getting under control. Well, then we know it flared up a second time, and we know last night it flared up a third time. So devastating and lots of damage. It's going to take a long time to fix the Parliament. I said to the President that day, and I'm happy that the Mayor followed through as well, the Mayor of Cape Town offered the chambers in the city. They're not big enough to take every single member of Parliament, but pretty close, and we can do a hybrid session around it. Also, the convention centre, I've spoken to the CEO and to the chair of the board. They're able to transform into an immediate parliament. And it's not, I mean, you also have to have a parliament ready. I mean, if there was another disaster or there was something that had to be dealt with by parliament immediately, you should be able to call the parliament within hours. So we need to make sure that that capability is there. And then, of course, then there's the long-term. You know, how long is it going to take to fix it? You know, we've got to rebuild that building. Well, I say we, but I mean it's got to be rebuilt. It's going to take a bit of time, and I think a mixture between hybrid and a place. And I presume that we've got enough facilities here that we could make it happen.
Yeah, and of course, I mean, the 49-year-old suspect appearing in court today is quite a big move, I suppose, in trying to find some answers to what exactly happened. But, Prem, I'm sure you would agree that prevention is better than cure. Surely there should have been measures, to try and prevent this. And I was reading a couple of articles here, criticism against the president saying because now state security is in the presidency, how did they not know or they have an idea that there would be a concern or at least danger to Parliament?
Well, I mean, if you read the reports, it says in 2018 they were already warned that the systems are not operational, it's not happening. And secondly, I think the real question to ask is when last did Parliament do a proper fire drill? Did they go and have a look at why the sprinkler systems are not working? Why is the alarm not working? Why is the water pressure not adequate? They've got to go and have a look at those things. You should be running regular tests. It's about called risk management, and risk management across the board needs to be in place. It's also a check. We all need to be doing that. Doesn't matter where we are, in our homes, in our businesses, wherever we are, go and have a look at your fire system because it's something that you've got to continually do.
All right, we'll leave it then. I appreciate your time this morning. Western Cape Premier Winde, thank you for joining us.